Now, COVID-19 vaccines are close to approval in the U.S., a light at the end of the tunnel for many. But one hard truth is the medical world knows that it's grappling with it's just not everyone trusts a vaccine. Many Black Americans, for instance, are more skeptical of government-backed treatments after a long history behind this. And joining us now to discuss health equity and navigating the relationship between the Black community and the government vaccines is American Medical Association President, Dr. Susan Bailey. Thank you for joining us, Dr. Bailey. I want to read a tweet to you that came out from Massachusetts Congresswoman Ayanna Pressley earlier this week, on this topic. She said Black Lives Matter also means, number one, any vaccine must have efficacy for those with high blood pressure and diabetes. Number two, priority distribution to communities hardest hit by COVID-19. And number three, a strategy to combat Black Americans' vaccine fears and skepticism because of the Tuskegee experiment. Let's start with vaccine hesitancy. To many people, they feel like there's a vaccine, you take it, no questions. So can you briefly explain some of the reasons you've seen behind vaccine hesitancy in the Black community that people may not know of?
Well, thanks for having me. And yes, vaccine hesitancy in general was at an all-time high before the pandemic began. And unfortunately, it has just increased. And that is especially concerning in Black and Hispanic communities where there is a long history of mistrust of medical institutions and outright mistreatment of those citizens. And so I agree with everything in the tweet. We need to prioritize marginalized populations who have been the hardest hit by this pandemic. We need to make sure that the vaccine works in people with various chronic diseases, which are more prevalent in marginalized and minority communities. And we need to work hard to make sure that patients understand that the vaccine, even though it's been made very quickly, appears to be very safe, very effective, and we all need to get behind this to help get this pandemic behind us.
So how do you tackle something this huge? It's got so many different branches to it. How do you approach this? Where do you start?
Well, as far as the health equity message, the AMA established a Center for Health Equity last year, way before the pandemic ever started, to make sure that we were incorporating health equity into all of our activities and everything that we do. We have been working hard to educate physicians on the importance of prioritizing minoritized communities. And to me, it's all about communication. You have to have transparency. You have to be honest. You have to tell people what they need to know and sometimes what they don't want to know. And I think the message has to be consistent. All of us need to work together to make sure, whether it's people in minority communities, whether it's physicians, whether it's political or public health leaders, we all need to have the same message. That is, we all have to work together to defeat the coronavirus. Vaccines are our best hope, and that we need to communicate about it and convince people that it's the right thing to do.
Is that part of the strategy to try to help build more trust within marginalized communities with government and the healthcare industry? I wonder, what are maybe the top two ways you believe that the industries can begin to build back trust with Black and Latino communities who have had deep distrust?
Well, I think as far as the COVID-19 vaccine is concerned, the vaccine manufacturers have done, I think, a really incredible job making sure that adequate numbers of Black and Hispanics were included in the study populations. They've done a good job of that. And now I think the next step is to make sure that there's more uptake in the community. And I think we've got to be very, very conscious about our messaging and also about understanding that even though there may not always be a situation where the patients can come to the vaccine. We need to make sure the vaccine comes to them. So there's going to need to be some unique outreach in minority communities. And I think physicians need to be very, very conscious on how various disadvantages can make it more difficult for patients to get the vaccine, even though they need it the most.
Well said. Last question. We had your colleague, Dr. Willarda Edwards, on last week when the AMA classified racism as a threat to public health. How will the AMA's new commitment to dismantle racist policies and practices, how will that address some of the concerns that you see Black and Latino communities have about vaccines in general?
I think that this focus will help us do a better job of speaking to our patients in a more culturally competent manner, to be aware of the unique barriers, excuse me, that minority patients face in staying well and leading healthy lifestyles and having access to, our wonderful modalities like immunizations. I think, seeing things through that lens in everything that we do, whether it's vaccine education or administration or allocation, I think hopefully will help rebuild some of that trust that's been lost.
I'm going to put you on the spot here, Dr. Bailey, and ask, what do you think you've heard of as the top barrier that keeps these communities away from these kinds of vaccines, these kinds of relationships?
I think it's just the lack of access to good health care in general. Minority populations are less likely to have good health insurance. They're less likely to have doctors and nurses that look like them and that live in their communities. And I think but just addressing the basic issue of access to care is critical.
Dr. Bailey, thank you so much for joining us today. We really appreciate this interview.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quicktake now for insight in an instant.